my name is Rachel, and I will be doing a cardiac respiratory assessment today for Nursing 383. I'm going to start by entering the room, washing my hands, and introducing myself. Hello, my name is Rachel. How are you doing today?
Good, how are you?
Good, good. And while I'm doing that, I'm going to be assessing her respiratory status. What is her respiratory rate like? Is she intractable? Is she symmetrical when she inhales and exhales? And all of that looks good right now, so I'm going to move to the back over here, and I'm going to inspect and palpate back here. I'm going to start above her scapula here and moving down and across, and down and across, and then I'm going to percuss. I'm going to listen for any abnormal sounds, any hollow sounding things using both of my middle fingers. Listening here. Listening for anything out of the ordinary. Alright, and all that sounds good. Alright, now using the diaphragm of my stethoscope, I'm going to listen for bronchial vesicular sounds up here above her clavicles, and then vesicular sounds down the rest of her back. Alright, all of that sounds good, so I'm going to move to the front. I'm going to do the same sort of thing around here. Going to palpate, looking for anything out of the ordinary, any tenderness, anything that may be painful to them. The ribs. Okay, next I'm going to percuss in the same fashion, using my middle fingers again. Alright, that all sounds good. Right, now I will auscultate blowing sounds using the diaphragm of my stethoscope again. And then here I will be listening to bronchial vesicular sounds here above the clavicle, bronchial sounds here right above the chest, and then vesicular sounds through the rest of the thoracic area. Okay, that all sounds good. Next I'm going to move on to the cardiac assessment. I'm going to look at her carotid arteries, and I'm going to look for any pulsations or palpitations. Next I'm going to feel both sides separately. I don't want to occlude both of those veins, maybe make her lightheaded or maybe make her even faint. So those are both good. Next I'm going to palpate her apical pulse. That's good. And then next I'm going to feel for the base of her heart. And then I'm going to turn my hand around and feel for the apex of her heart, which is good. I can feel that. Okay, next I'm going to auscultate using the bow of my stethoscope. Here I will listen for the apical pulse, or aortic valve. I'll listen here. Pulmonic, tricuspid, and mitral. Alright, and if I were listening for any murmurs or anything like that, I would use the diaphragm with my stethoscope, and I would make her make her sit up straight just like this. I would make her lean forward, and then I would make her lay left lateral. Alright, this concludes my assessment. I will wash my hands and exit the room.